Hey, good evening. My name is Josh, and I'm going to be your nurse. And tonight I'm going to talk to you about hypertension. I'm going to teach you a little bit about what it is, what causes it, some assessments we do for it, some labs we do to help diagnose it, any medications that can help with it, some specific nursing interventions I'm going to be doing while you're under my care, and some potential risks that could come with treatment. And I'm going to be giving you a few packets for you to take home with you. So before we begin, do you mind if I take a seat? Thank you. So before we begin, I just want to know, what do you know about hypertension? What do you think of? Yeah, that's about right. So hypertension is just another way of saying high blood pressure. And there are two kinds of hypertension. There is essential and then there is secondary. Essential hypertension is high blood pressure that is not caused by any pre-existing or underlying condition. And that's generally high blood pressure caused by obesity, poor diet, or lack of exercise. Secondary hypertension is high blood pressure that is caused by an underlying medical condition, such as kidney disease. And the risk of extended high blood pressure is that over time, it could cause certain serious health complications such as heart disease, stroke, and potentially even death. So I'm going to talk about some assessments we do to help diagnose hypertension. So we start by taking a overall health history. We look at your age, we look at your diet, if you have any familial history, any drugs you're taking, or just like how much alcohol you take in. And then we do a psychosocial assessment, and that is when we look at some of the stressors in your life, such as, through work or relationships. And then we conclude by taking your blood pressure just to see where you're at. Now I'm going to talk about some labs we use to help diagnose high blood pressure. So there are no lab tests we can do to test for essential hypertension, but there are some lab tests we can do for secondary hypertension. And one of them is testing for blood urea nitrogen level, and basically just an elevated level shows there is something wrong with the kidneys. Another test we can do is a chest radiography to check for an enlarged heart. And we can also do an electrocardiogram or ECG to help determine if the left atrium and left ventricles are enlarged, which could be contributing to higher blood pressure. Now I'm going to talk about some medication that can be prescribed to you that can help you with hypertension. So the medication that will be prescribed to you is individualized to the person. It just depends on your age, your background, and generally they're going to try to limit it to 1 dose per day just so that you don't forget or don't skip dosages. And some examples of drugs that could be prescribed to you are diuretics, some calcium channel blockers, and angiotensin converting enzyme inhibitors or ACE inhibitors. And again, like I said, these will be prescribed to you based on your specific needs. So I have a packet right here with all the information about all the drugs that could be prescribed to you for you to peruse, and it'll make more sense to you when you're actually prescribed a certain medication. So now I'm going to talk about some things I'm going to do while I'm your nurse to watch out for you. So I'm going to ensure you take your medications at the right time and the right dose each day. And I'm going to monitor for any adverse drug side effects. I'm also going to monitor for any potential hypertensive emergency. I'm going to teach you how to take and monitor your own blood pressure. And I'm going to teach you about what medications you're prescribed. And I'm also going to teach you about the dangers of not taking your medications when you're supposed to. And I'm going to teach you how to have a better diet, limiting sodium, limiting alcohol intake. And I'm going to help you develop an exercise plan based on your interests, what you like to do. If you like to swim, and including that in your daily routine. And like any treatment plan, there are some risk and potential complications, and I'm going to go over those really briefly. There are some potential side effects for medications you could be prescribed. It could be anything from coughing and dizziness to sexual dysfunction. If you miss a dose, there could be some potential serious complications. When moving from laying down or sitting to standing up, sometimes the change in blood pressure could cause dizziness, which could cause potential falls. And also with high blood pressure, you're going to have to make some changes, whether through diet or potentially if you smoke or you drink excessive alcohol, you may have to cut back, and that could cause some kind of withdrawal symptoms, and that could be a rough transition. But one of the biggest risks of our treatment plan is developing a treatment plan that doesn't work necessarily for you. So you don't follow it, you continue to have high blood pressure, and that leads to future complications. However, I'm going to, myself and our hospital team here, are going to work with you to develop a treatment plan that works for you, that'll keep you safe, and should hopefully keep you headed in the right direction. So included with all the stuff I discussed today, I have some packets about the medication and potential diet and exercise plans for you to peruse. So I'm going to leave that right here for you. There's the call light right there if you need me, and I will be back in a couple hours to check on you. Thank you.